Hi, I'm here in the Labor Party caucus room where this morning the caucus had a briefing from the Chief Medical Officer of Australia, Brendan Murphy, about the coronavirus or COVID-19. I just wanted to give you a couple of facts. As I'm sure you already know, it's a respiratory illness which is caused by a virus. Its symptoms, they do range from like a mild cough right through to pneumonia, but it could include fever, tiredness, or even a runny nose. Now, in terms of vulnerability, the emerging mortality rate seems to be about 1%, which in context is about 10 times worse than the usual flu season. Unfortunately, the elderly are particularly susceptible, and people with conditions such as chronic liver disease or HIV or the like. Children appear to be able to be infected, but they might only present in a mild way, and they might not even be aware that they have coronavirus. I should point out that the kids could actually still be infectious without actually displaying any symptoms at all that I've mentioned. I should point out also that flu vaccinations will not prevent somebody from actually getting the coronavirus. So what's the state of play? Well, about 76 countries so far around the world have had outbreaks, and sadly that number is likely to rise. Most cases have actually been in Wuhan City in Hubei province, China. Big country obviously, but still less than 100,000 people have been notified as having the coronavirus. The other big numbers are in South Korea, very reliable data there, and Iran. Iran's data could be a little less reliable at the moment. Countries are obviously endeavouring to contain the spread of the coronavirus, so slowing the spread so that the health systems are better prepared. There is a second wave of infections occurring, but I should point out that the Australian government is still trying to do contact tracing, so if there is a case, to work out how that person actually got the infection. Now, some other facts. Transmission, you need actually to be very close to an infected person, inside 1.5 metres or so. It could go from person to person via droplets, so you basically need an infected person to cough in the other person's face. No, so it's not like that aerosol transmission scenario that people had been warning about. Or you could have contact with an infected surface, that somebody had coughed on, and then you put your hand or your eyes close to your mouth or the like. So what do we do in terms of a practical response? Number one, if you're well, you actually don't need a face mask. Number two, practice good hygiene. So that's washing your hands often with soap and water. Now, what is a good washing? It's not a water wash, it's actually soap and water, and that takes about 20 seconds, or to put it in your mind, that's about the time it takes to sing Happy Birthday through twice. That's 20 seconds. Use a tissue or a handkerchief to cover your mouth when coughing or sneezing. Obviously avoid touching other people unless it's absolutely necessary. I know that handshakes are a part of life, so try to be aware of who the other person is and where they might have travelled recently. And remember, just go back to what I've said before, wash your hand afterwards as much as possible. People should just stay calm, go out and live your normal life, but just ramp up those hygiene responses, those hygiene habits. There's no need for people to rush to the supermarkets and undertake frenzied stock purchases. So reassure your friends, your neighbours, especially your elderly friends, family and friends. Now, if they reside in an aged care facility, just ask if they've ramped up the hygiene procedures. Do they have a quarantine plan for the eventuality of a coronavirus person being infected in that aged care facility? Let's carry on, keep living our lives, and I'll make sure that I give you as much up-to-date information as possible.